support.
Okay, gotcha. So yes, this is also in the arena of substance abuse treatment. AB 920, which is known as Jarrod's Law, will improve and update California's framework for substance abuse treatment. This is a critical first step to enable lawmakers to develop sound policy in this area. And with that, I'm really pleased to introduce the supporter here to testify, Wendy McIntyre, the founder of Jarrod's Law.
Okay, thank you. Welcome. And
Chair and members, my name is Wendy McIntyre. In 2004, I got that call that no parent wants to get. My son Jarrod died at a sober living home, ironically called a safe house. I wanted to get in bed and stay there, but instead I decided to become better and not bitter. Now I dedicate the rest of my life to saving others by founding Jarrod's Law. My story is not unique. I stand here today for the hundreds of victims who have lost their lives at rogue rehabs. I investigate these deaths daily, and I am horrified at what I've discovered. In 2014, I got a call about another young boy, Donovan Doyle. Like my son Jarrod, he died in a rogue rehab. Then there was Terry, Robert, Chad, Eric, James, and Matthew, who all died at the same facility. Joey, Corey, Caitlin, Brandon, and dozens more who have died in Orange County. A week doesn't go by that I don't get a phone call from a heartbroken mom or dad. I cannot keep coming to this state with this list of dead boys. 200 people died yesterday of overdoses, and 200 will die today. I am here today to give a voice to victims, survivors, and fighters as we challenge this billion-dollar industry that places profit over people's safety. The stigma of addiction and the fear of being judged will often have families wait until the last minute to reach out for help. They often feel terrified, alone, and desperate to find help for their loved one. Some providers will strategically prey upon this fear to get a young person into their so-called treatment program. For many families, this predatory behavior will appear as a gift, a kind and compassionate stranger who can answer their prayers until their child is returned home in a body bag. The Mental Health Parity Act and the Affordable Care Act significantly increased the access to mental health services over the last decade, expanding coverage to more than 62 million Americans who had little to no benefits before. However, this rise in access to rehabilitation care through the ACA and MHPA, combined with the heightening opioid and substance abuse crisis and infusion of private equity dollars into the rehabilitation industry, has created an environment ripe for profiteering and fraud in mental health and substance abuse treatment. Jarrod's Law is about being able to get sober in a healthy and safe way. There must be fail-safes in place. I'm here today as Jarrod's mom, and there are hundreds of other activist mothers and fathers seeking change. Although change won't help bring any of our children back, it will create a legacy for future members of our communities to receive safer treatment. California is the largest economy in the nation, and we must do better for patients.
Thank you so much for sharing this, and I'm sorry, son. All right, other witnesses in support.
Good afternoon, Mr. Chair and members. Connie Delgado on behalf of the County Behavioral Health Directors Association. Want to thank the author for the recent amendments and in support, also for the California Society of Addiction Medicine. Thank you.
Okay, thank you.
Maxine Mantel on behalf of the California Association of Alcohol and Drug Program Executives in support.
Thank you.
Sherry Daly with the California Consortium of Addiction Programs and Professionals in support.
Thank you. All right, seeing other witnesses support, any witnesses opposition? The bill's been moved by Senator Stone. Senator Stone, did you have?
I just wanted to thank the witness, and I'm sorry for your loss, but I appreciate that you're dedicating your life to trying to stop this senseless loss of life. And I think it's appropriate to call it Jarrod's Law. I appreciate that Assembly Member Petrie Norris is bringing it forward. And I can just tell you that many of my colleagues are going to continue to try in the public safety arena to strengthen the law so we can hold those accountable for peddling some of these very dangerous drugs like fentanyl on innocent people that use it and ultimately pass away from it. And you're absolutely right. Another 200 are going to go today, and we need to put the brakes on it somehow. But you being here is very important, and my condolences to you.
Thank you. Thank you. Senator Monning.
Thank you, Mr. Chair. I also want to thank the author for bringing this forward, and thank you, Jarrod's mom, for your processing your loss by helping others and helping us to hopefully save the next Jarrod. Thank you so much for being here.
Okay. Thank you. And again, I want to thank you, Senator Petrinoros, for bringing this forward. And again, I want to thank you so much for sharing your story about your son, Jarrod. And I'm so sorry about what happened to him, but glad you turned this. Hopefully we can try to address that for anyone in the future. So with that, would you like to close?
Thank you for those comments, and I respectfully ask for your aye vote.
Okay. Thank you. Okay, so the motions do pass and refer to the Committee on Appropriations. Secretary, please call the roll.
Han?
Aye.
Han, aye. Stone? Stone, aye. Gonzalez? Gonzalez, aye. Grove? Hurtado? Leyva? Mitchell? Mitchell, aye. Monning? Monning, aye. Rubio?
Okay, currently has 5 votes. It's 5-0. Hold the roll open for absent members, but that's enough votes to get it out. Okay, so your next bill also has support